Nadia, you want to go for it?
Yes. Hello, welcome everyone. My apologies. My video is off. My service is pretty bad right now, but just want to welcome folks to our War on Youth meeting. We have it every second Tuesday of the month. And today we're going to be looking at public health. We have some great folks to share with us, as well as PYM, who is our co-organizer for the War on Youth movement. And today, I think instead of going into some of the programs that we fight as part of our War on Youth, I think the context is still going to be laid. Just in looking at, thinking of the fact the 20th anniversary of 9/11 just passed. And so, what does that mean? How, and as we always say in the coalition, these are continuations of history. And so, want to go ahead and welcome folks. And for the logistics, basically, we do have the chat open for tonight. So we'll just be keeping an eye because we have had obviously people say some pretty terrible things in the chat. So we'll be keeping an eye on that. But I want to invite folks to go ahead and put questions in the chat, put comments. And then in terms of the mics, we do, you are not able to, I can message one of the hosts and we can always unmute you as well. So, yeah, I don't know, or Celine.
No, not really.
I'll take it as a no. All right.
Maybe,
Cool.
before, when we go to Celine, we can share her. Celine, if you want to be on camera, it's up to you instead of the screen.
My camera is not working, so
okay.
I only have audio.
Never mind.
Do you want me to go ahead?
I didn't mean to cut you off, Nadia. Sorry.
Yeah. No, you're good. Actually, go for it, Celine. Continue.
Yeah, I mean, I just wanted to share some really brief reflections from some of the discussions that, we've been having inside of the Palestinian youth movement this past week, especially, and kind of based off of what Nadia just, posed the question of like, what does this mean? Having the 20th anniversary of 9/11 having passed and thinking about the so-called war on terror. And we've also been thinking a lot about the heroic prison escape that took place on September 6th in Palestine. And thinking about war on terror and how we've been looking at it at the fight against the war on youth, like looking at the war on crime, war on drugs, war on terror, how policing surveillance has been expanded, what are the shifts that took place. Something we've also been really looking at together has been the role of Zionism in all of this, and how the so-called war on terror, how it's such a major part of the Zionist colonial project. And one thing that one of the PYM co-founders, Dr. Lubna Qatami, she wrote something recently about how, the importance of the 9/11 moment was that it facilitated a material convergence of domestic racialized repression tactics with militarized logics and technologies used abroad, and proclaiming itself as the forerunner of the so-called war on terror immediately following 9/11. The Zionist state has played a critical role in developing the racially manufactured hysteria that legitimized all these expansions of borders, of policing, of militarization, of repression, of extrajudicial killings, of crowd control, and of surveillance. And it's also important to understand how the Zionist state has also learned these logics and techniques from its intimate friendship with racist and colonial states also throughout its history. And, one thing that we've been, we're with Stop LAPD Spine Coalition and PYM, we're both also participating in the International Witness Campaign that CAGE in the UK are organizing, and they're one of our partners. They do a lot of organizing against Prevent in the UK. And we put together this piece that we'll hopefully be sharing soon about Zionism and countering violent extremism, and Zionism and this framework of terrorism more broadly. And one other reflection that I wanted to share too is just that, there are some major corporations that have profited over the past 20 years, especially Lockheed Martin, Boeing, Raytheon, and this expansion of the threat of quote unquote terrorism has effectively, given rise to frameworks and policing, frameworks like countering violent extremism that we're fighting right now. Like, this is the focus of our Fight Against the War on Youth campaign, is countering violent extremism in schools, and the role that these Zionist organizations are playing in implementing those in schools. And this expansion of the threat of terrorism, quote unquote terrorism, and how it's effectively, it's not just been about like suspending freedoms, constitutional freedoms, it's also been about stifling political dissent. It's about trying to crush resistance and to prevent, our people from being able to build out self-sustainability, like autonomy, mutual aid. The very real impact is that our organizing gets criminalized through these frameworks of countering violent extremism and other policing and surveillance and repression tactics. And yeah, just in thinking about like how, for example, like Israel has secured itself, especially after 9/11, as a leader of war industry, of all this counterterror strategy, policing and surveillance. It's been really, it was maximum security prison in the Zionist state were able to shake the entire colonial system by digging themselves out of prison and escaping. And although they've been, 4 out of the 6 have been arrested, it does not undo the fact that this is a huge victory for the Palestinian people, and that all of the billions and trillions of dollars that the United States and that Zionist state has invested in militarization and surveillance and intelligence and national security and policing and colonization and repression, that those things are not impenetrable. And, just wanted to take some time to acknowledge that and, share that the recent updates from the ground in Palestine is that prisoners are protesting. A lot of prisoners are receiving collective punishment, and they're going to be launching a hunger strike most likely this Friday. And Palestinian Youth Movement will be putting out some materials to participate in campaigns and organizing in support of not only the 6 prisoners who escaped from the prison and the 4 who have been rearrested and who are currently undergoing torture at the hands of Zionist prison guards, but also to support and to push for the freedom of all Palestinian prisoners and of all prisoners across the world, and understanding that all prisoners are political prisoners. So, just wanted to say that some of the discussions we've been having in the POM is that, regardless of what happens now, this attempt is going to be remembered forever. The fact that were able to defeat Zionist security system and intelligence with 0 capabilities, basically. And that regardless of the outcome, they proved that the Zionist entity is still, it's just not impenetrable, and that, it reminds us that our liberation has to be taken, that it can't be negotiated or asked for, and that we need to be centering prisoners in all of our struggles. And I'll pass it back.
Thank you, Celine. That was Celine from Palestinian Youth Movement. We co-organize the War on Youth the fight against the War on Youth with Palestinian Youth Movement. And now we also have a very special treat and really important gift for the community and for us too, from Dr. Bita Amani and Brianne McAndrew, who are part of the Stop LAPD Spying Coalition's group that are looking at surveillance and public health, who are going to talk to us about COVID and better understanding how to, I'll actually let them introduce themselves, sorry.
Hi, everyone. Can you all hear me? Yes, are we good? Okay. It's a pleasure to be able to be here with you all. My name is Bita Amani. I am a professor at Charles R. Drew University of Medicine and Science. And I come tonight as a member of the UCLA CDU COVID-19 Racism and Equity Task Force, where we've been trying to do, I don't know, the big sigh here, some sort of support to our community partners and folks that we've been organizing and building with for over a decade here in LA during the pandemic. And so that's looked like so many different things, whether that's doing community-based participatory research projects together, or just literally trying to figure out how to increase access to testing and vaccination. So we've been trying to do a lot of that work. By training, I'm an epidemiologist. I started off in infectious disease epi with a little bit of disaster preparedness work, but mostly have been doing social epidemiology for the last 10 years. I come to work with should I continue? Around the issue of COVID data, public health data, the weaponization of data through public health information sharing. So we started to build together as a working group with Hamid, with Jamie, with Brianne, with Consuela and Mina, who are not here, on just thinking through issues of technology, apps, databases, DHS contracts, where data is needed, where they say data is lacking, what are the system problems. So we did a lot of that work, I would say, over the past year and a half. And Brianne, I would love for her to introduce herself. Right now, she graduated from our public health program at the university, and she's been a key kind of I would say she's our main researcher across pretty much everything that we're doing right now, whether it's from structural violence or to looking at data that's being gathered around racism and public health, and also just the continued work that she's interested in.
Hi, everyone. I'm happy to be here. Like Dr. Ramani said, I just finished at Charles Drew with my master's in public health. And Dr. Ramani introduced me to the coalition a little over a year ago now to do work around the intersections of like public health and surveillance and the police state, and the ways that data can be weaponized, and the ways that, the pandemic is being policed. And so we started looking at data sharing and where testing and contact tracing data is being shared, and vaccination status and vaccine passports and that kind of stuff. And so we came to talk today about, like, coming from the public health side of things, specifically with this War on Youth group, knowing that a lot of you are educators and work in LAUSD or other school systems, and to understand the data that's being shared with, like, the reopening of schools, understanding what data is available and how to interpret that data and understand that data to best empower yourself as an educator and, keep your community safe.
And because, like all projects we've been doing, that whether through the task force and I have to give all the disclaimers. I don't come here as representative of the university or any institution, right? I come here representing only BETA, and Brianne comes here only representing Brianne, right? That through all the types of collaborations we've been doing, the whole part about it being participatory is really important. So when Akil and us, we met over the weekend. Already from just that exchange, there were things that we knew that, hey, like, we need to push them to be more responsive to this. We need to take this information. We need to take it back. We need to have this conversation, because it's going to be through your questions and your observations that we're going to also be able to possibly put some pressure in a different way around what is really useful and what's not, and what and then I think, like, the 2.0 or the 3.0 of these exchanges can be for us to develop our own standards by which we want to compare this data, because a lot of what we're going to be doing probably today and in the near future, if we all think that it's important for us to continue to have these conversations, is kind of understand what's available and and how to interpret it. But then as we move forward, obviously we're going to want to be able to say, they say this is the standard for which we should start to think things are going south, right? And I don't mean global south good, right? I mean, like south is not good, but what should ours be? So like that's the place that we want to get. Okay, so if we're okay, should I get into it? Is there anything anybody wants to ask right now or to say before we start sharing? Okay. One of the things that I thought was really good last time was when the question was asked, where do people get their COVID-19 data? Where do you guys go to? Where do you all go to get that information? If people don't mind like posting in the chat while I open up all the screens. Okay. Okay, so maybe we are not able to post in the chat. Okay, there we go. CDC website, Johns Hopkins website, great. I do the CDC and the Hopkins as well. I try to do that more regularly, especially the Hopkins for the global data is really great. And the CDC has really good statewide, nationwide hospitalization data. And they have these weekly reports they put out where they put out these studies that have been done throughout the week that have some really good information, and we can post a link to that, as well. Okay, so we pulled snapshots from the public health virtual media briefing that Barbara Ferrer does and has been doing throughout the pandemic. And this one was pulled from the video that's September 10th, and you can go here and click on it to get to that video, which is on YouTube. On these videos on YouTube, she goes through the most updated data. She gives explanations on maybe corrections to data that was presented before, or maybe new observations. She like briefly talks priorities. And then at different points of the pandemic, she's been reviewing different types of information. Now she's doing a lot around vaccinated and unvaccinated. And of course, recently been doing data debriefs that are specifically about what's going on in LAUSD in the schools and how is public health, in her own words, monitoring what's going on in the schools to see if this is something that should continue to go forward the way that it is, or if, something needs to be, scaled back, transitioned, or whatever. So as like different issues become important around wanting to know how policy decisions are made and what the impact of that is on community transmission, hospitalization, and death, then she, in her presentation, will adjust. The presentations that we've gone through both of these presentations. These are two that have been put into the slide deck. Brianne, if you don't mind, can you share the address to this, the Google Doc link to this presentation in the chat? So, we put together a presentation. When you go into the Google Doc, you'll see that the slides in yellow are her slides that she presented that we want to review with you all very quickly today, so we can get into the part where you all can ask questions. But then we also included at the end of the slide deck slides that are with a background in white that are not we're not reviewing, but those are all the slides in both these presentations. In these data debriefs that she does, she also takes questions from the media, and there's also a translation of the entire presentation in Spanish at the end. So even though it shows up as being like an hour, maybe like 15 or 20 minutes, her presentation is probably no more than like 25 minutes, right? Wouldn't you say, Brianne? It's like a small chunk in the beginning. So if you start to want to watch these regularly, it's not too much of a, it's a bit of a time commitment, but like not the other one. So right here is an example of a slide that she is going to always show. She wants to tell you what's going on right now on a given day. And she wants to also tell you what's been happening cumulatively. She's going to give you numbers that are absolute numbers, and she's going to give you numbers that are called relative numbers, right? These are numbers that have denominators, and the denominators help us to be able to then take these different relative numbers, these rates, and compare them across groups, and group by any way that you want to define group, whether that's by place, by race, by a lot these days by vaccination status. so on, so forth. But this first slide is always like, this is everybody together. Deaths reported today is, just simply that. It's an absolute value of deaths that are reported on that day. Total deaths, right, represents, total deaths of the pandemic. Cases reported today, similarly, absolute number, and then total cases up to this point. This reflects the total people that are tested. Obviously, some people get tested more than once. So it's every time someone gets tested is reflected in this absolute number. Here, these next two numbers are what we're calling the relative numbers, the rates. The daily test positivity rate takes the number of persons who tested positive for a COVID-19 test over the total number of people that got tested. The 7-day daily average case rate is what we call a rolling average. It is taking the number of people who tested positive for COVID-19 over the last 7 days and creating an average daily rate based on that and presenting that. The 7-day period is the 7-day period prior to the day that the number is reported. And currently hospitalized is an absolute number of all the people that are in the hospital for every person who's hospitalized who tests positive for COVID-19. Okay, so in the LAUSD data that Dr. Ferrer was presenting, she does a lot about setting up what's the status of the kids right now, like what's their health like for those who are, under the, that are under 18 years of age. So like the population of kids that would be in school, and she separates them out by the different age groups. And then she takes us through some of these rates, and they are rates that are shown to us over time. This is that same kind of concept, but now instead of just looking at COVID-19 positive, right, cases, here we have hospitalization rates. And then this is something that is new. We've been trying to interpret it. We've been listening to the data debriefs. We think this might be important to you all as, for those of you who are teachers, but also just very concerned about what's going on in the schools. They've taken the data across different locations. So K through 12 district office worksite, a K through 12 school. To the best of our knowledge, and we have to confirm this, but to the best of our knowledge, this is a K through 12 school that's a non-LAUSD school. So that would be a charter, right? Then the K through 12 daycare and LAUSD schools, and then youth sports. Now, why this distinction between K through 12 school and obviously LAUSD? As you all know, there are different protocols in place, right, for a non-LAUSD school versus an LAUSD school. In addition to that, there's another type of data that's coming out of the non-LAUSD schools, which is the data on vaccination status. So because LAUSD is not collecting data on vaccination status, that's not data that they can report. But the non-LAUSD schools are, so then that's why you'll also see, for example, in the last two columns, some data that pops up about percent that are fully vaccinated amongst those cases. And so then another, other type of data then she now starts to show, because this is a big point that they're trying to make across all their data debriefings, is they are trying to advocate first for vaccinations, then they do a little bit of advocating for testing, and obviously the mask mandates, are there. So then, this is looking at the pediatric, so the cases in those less than 18 by vaccination status. And then the next couple of slides are them reporting on, when, how many cases, how many investigations were happening across the different facilities. And then they separate out the information by cases, sites that are reporting 1 case, 2 cases, or 3 cases. And then she, tries to explain more about what exactly is a case investigator, what are they doing, what's a contact tracer, and what these definitions are. So now what I'm going to present is a slide that more sets up for the data that comes from the presentations that are about LA County overall, so that weren't targeting LAUSD employees, more directly. So in the larger Los Angeles County data debriefings, they always take the case rate in Los Angeles County along with its positivity rate, and they compare it to the different thresholds defined, used by the CDCs to indicate different levels of concern. Obviously, as the colors go from blue to red, you can see that the concern becomes more. And concern is based on having at least met one of these thresholds. And you'll see that LA County, as of 9/10/2021, was meeting the threshold for high transmission based on its cumulative 7-day incident case rate, which is right here, indicated right here. When you look at these numbers, I don't think we're going to, when you guys go to the dashboard, you'll probably be able to see, we're seeing that the case rate is now starting to come down a little bit, but it's been very high, or it's been greater than 100 and even higher for certain communities for a minute now. Okay, so then they go through the data, they want to explain it by vaccination status. Here, they're also explaining, trying to show what's happening by the case rate by age, so vaccination and age over time. Then they're doing the same thing, but by race and ethnicity. The dash lines are always unvaccinated and the solid lines are always vaccinated. Then they also do the same thing for death rates and hospitalization rates. So that's, the ones that kind of group together, the case rate, the hospitalization rate, and the death rate. And I'm going through these quickly because we want an opportunity for you all to review it. So that's it. I'm going to stop there and let Brianne talk a little bit about these data dashboards. And you can go through the slides and the slide deck because we'd like to stop and give you all a chance to review and ask us questions that we can be, I think through the questions we can, do some better thinking through this stuff together.
So did you want to go through the different dashboards or take questions?
Akil, what do you think is better? Should we go into the dashboards? Because we at least want to show everyone the parent dashboard, because I don't know if folks are familiar with that.
Maybe just so that people don't forget the questions they have about what you just showed, we can do one round of questions now, and then we can go to the dashboard and then give people a longer time to actually look through everything after that.
Excellent, good idea, thank you.
So any questions, and feel free to either raise your hand and we can unmute you, or you can post in the chat that you would like to speak, or you can just put your question in the chat. And you can do it publicly, or if you want to do it anonymously, you can send your question to me in a private message and I can read it out loud. Okay, and Hamid is also, yeah, okay, yes. And we're also gonna allow people to unmute themselves too. So any questions for Bita or Brianne about the LAUSD's dashboard? Is that right? No,
or
not
for any of the
dashboard, sorry. Barbara Ferrer's presentations
yes.
and how to understand that information. Sorry, I misspoke.
Perfect.
I have a question to start it off. Well, two questions. First is, could you talk a little bit more about and kind of break down in simple language what the difference between absolute and relative number is and what a denominator means? And then also the second question is just in terms of in popular language, what is substantial transmission? What is high transmission? What is moderate and low in terms of risk level?
Yeah, that one is a really good question. If anyone wants to answer that, how they're doing this part, that'd be good. But let's start with the first one around the denominator. Okay, so on this slide, we have both absolute and relative numbers.
You have to reshare your screen.
Oh yeah, that's a good idea. Okay, are we good? Yeah, okay. Here we have, for example, an absolute number. Total number of deaths that were reported today, 50. Now, in order for us to be able to compare that to say, like, let's pick Orange County, right? Say Orange County's deaths reported today are, and I'm just gonna make up a number, right? Like 30. How do we know how we're doing relative to Orange County? Well, in order for us to be able to know how we're doing relative to them, or to compare ourselves to them, we'd have to put this number of deaths today over the total number of people that, right, that were at risk of dying. So the population, right? The number, and I'm just going to put it over the. I am so bad at doing this. This is like killing me over here, but yeah. Over the population, right? Okay. And that helps us then to, if we were to do this for both of these numbers, to create some sort of standard so that we can compare. And, you know, and a great, you know, like to think about this, like say LA County only has like, you know, say Orange County has only 100 people in it, but LA County has like 1,000 people in it. Like that would matter then in terms of like what the actual, you know, what the actual impact of that is for the entire population. And so whenever you put the absolute number over a denominator, you get a relative number. And that relative number then lets you compare, and not only compare by place, or say by, if you want to compare by, days, right? It allows you to compare anything over any other indicator. So did I do that?
Yes, absolutely. So basically, if you hear in the back of your head like the word per afterwards, then it's likely a relative number.
It's absolutely a relative number, yeah. And then some of our relative numbers are better than others. So wherever you can see a relative number that is adjusted for something, that's like, you know, a much better number to use for comparing in certain contexts. So for like, if you hear, for example, age-adjusted hospitalization rates, right? Or age-adjusted death rates, then the populations that you're then comparing those death rates between, those populations have been like the factor of them having different ages within those populations, it has been like standardized against that so that you can actually compare those numbers. So you can think of it as like removing that factor, right, from looking at, you know, the health of those populations. Okay, and so then your other question around thresholds. A lot of these thresholds were linked to decision-making around opening up. And they were based on like limited evidence, but the evidence that had been gathered up to a certain point around how infectious was the virus, and also, you know, in what settings, right, that risk is happening. So these standards here have changed, like, you know, over time. In fact, when we were doing the research for this presentation, Brianne had found like, you know, older CDC thresholds, which were like so much lower, you know, than these. So then these numbers are based on a agreed upon, like, you know, a previously agreed upon acceptance of how much virus it's okay, you know, to be moving through a community. And they're all connected to obviously policy decisions that would need to be made. You know, and a lot of, when you go back to the history of it, as everyone here knows, you know, very much connected to, you know, what's a balance between like economic health, you know, and people's health. So that's been, you know, the larger story of COVID.
Got it. Any other questions on Dr. Ferrer's presentation slides that Dr. Ramani has been showing us? before we move on to looking at the dashboard. Feel free to unmute yourselves or post in the chat. This is a great opportunity to have these questions answered in great detail. So,
and even
I
if
have a
it's
quick
not
question.
about, oh yeah, please go ahead.
Yeah, sorry, I'm keeping my camera off because that's why we had a momentary lag because somehow my internet is also acting up. So today there was this news around where there's a reduction by 23% or something like that in California compared to the rest of the nation, or based upon previous averages, and they were saying that there's just 3 places: California, Vermont, and maybe another place. So what do we make of that?
You know, I want to go back to the share. So I think on one hand, like that's always good to see, right? Like any sort of, I don't want to necessarily do the ones by vaccination status. Let me see if I have any. Okay, I don't have another one, right? So whenever you're seeing any reduction, that obviously like is good news, right? Versus like bad news. But when I'm hearing something like that, I'm getting worried about like, okay, are they going to start communicating messaging of like, that surge is done, therefore let's relax on the mask mandates? Because if you have, like, if we've seen anything throughout this pandemic, it's that like things are cyclical. So and also that whenever you're surging, that a peak is hit, and that you then come down from the peak. So this is not a good enough slide to show this. This is not proper data. I'm trying to see. Yeah, this one goes back more, right? And this is just for pediatric, right? Like age groups or anyone less than 18 years of age. But because things are cyclical and things then like you have smaller increases, and then you have larger ones, and then they get to a certain place where then that's when you start to hear that the hospitals are going to be overwhelmed, right? Like they're hitting their capacity or they've exceeded their capacity, and then we're calling those like larger increases, surges. The cyclical nature of it, right? For me, is part of what I think is concerning. So while I'm happy that there's a decrease, because that just means that there's less virus in circulation, and we're coming down from the peak, which all the trends over the last couple of data debriefings appear to they indicate that. For me, it's like, okay, now if we start to communicate to people, now relax, and then pretty soon, because this is what's being shown in so many different places, right, all around the world, things then start to pick back up. And then it's a matter of how fast, again, can you respond to go back to some of the earlier protocols, right, before. And then the other concerning thing here is the way that they split up populations by status, by, vaccinated and unvaccinated, and a lot of, that kind of good old fashioned pandemic stigmatization, right? Like that goes into effect, that can always happen, right? The way that, people, communities are racialized and stigmatized, and, and how that's, deeply connected to politics and in history, like all that stuff that's there, but they know it, we all know it from previous pandemics and experiences with any sort of public health, situation, that right now that has resulted in a group of people, the vaccinated, having thought that by getting vaccinated, they bought and that they got a prescription for a lifestyle, and that we're expecting, right, to be able to have certain opportunities because of that. And so now we're also dealing with different expectations and different desires by different groups, and we've split people up, and all the ways that that's gotten more complicated. Now, when I'm seeing that the numbers are going down, I'm like, now what does this mean? Do people think that they can kind of go back to some previous behaviors? And then the worry part about that is the vaccines, we're seeing more people with breakthrough infections. So the behavior of the folks who are vaccinated is extremely important, because they are both getting sick and also able to transmit disease. So this is kind of probably not what you wanted to hear. Ahmed, you're probably like, okay, like it's good. It's like getting better. We can all like relax. But for me, like just, another intensity hits me of every moment we've been here, we have not made smart decisions as a collective for what to do about this opportunity that's being presented, right? From like the typical decrease in like cases.
I don't know how to put a sad emoji in there.
but some of us are trained to always look at the negative, but if we had done things in the past that showed that we could take advantage of these moments where transmission is coming down to make like better decisions with each other, but that's not right. Like, as we all know, like what's happening around evictions and all the other social, like whatever we're calling social determinants of health, everything that's a basic essential, right, like need for people to live healthy and with dignity, all of that is under attack. So when you see decreasing cases, it's in the context of like, we still have a lot of like pressure that we're putting on the city to not focus on something that's essential, because we have all these like other really crucial and essential fights. So.
Thank you so much. Maybe for the sake of time, because I want people, and I know both of you had wanted people to be able to check out the tools too, and then ask more questions, we could move on to the presentation or on the dashboard, and then we can make sure that people know how to get on and spend a couple of minutes with the people looking at the tools themselves. Okay. But if you had more questions around this topic, remember them and either write them in the chat or keep them to ask after in the next round of questions.
So there's a few dashboards that we're going to show that you can use to check this data. In addition to Barbara Ferrer's updates, there's actually like the data written out. Unfortunately, this first one, the COVID-19 report card, is like down for some reason. It was fine all day, and now it's not working. But the link to this is in the slides, and you can look at this one later, but and I can explain it after. But the first one that maybe we can go through, and I'll put this in the chat, is populated by that data. So they use the LAUSD data and LA County Department of Public Health data. And this essentially, it's put together by some parents and from LAUSD students. And the goal of this was to create like cumulative data. And that's because the LA County, this COVID-19 report card just has active COVID cases and didn't have anything cumulative. So that was like the goal of creating this alternate data. So this data is populated though daily from the LAUSD data. And so in this first tab, it's just general information about where the data comes from and some definitions that these are the same definitions that LAUSD is using about what active COVID cases are, what cases from school-based transmission are, as opposed to which are positive cases that were determined to be linked through contact tracing back to the school. So that it's confirmed that the student became COVID positive because of exposure at school, as opposed to community-based transmission, which means maybe the kid got it when they were at the store or, playing with a friend at the park after school. And then the community case rates are case rates of the surrounding communities around the school. The staff and student case rate is the rolling average of daily cases per 100,000 students and school-based staff in that school. And then they compare to the LA County case rates. And so you'll see what I'm talking about in the different tabs. So the first tab is individual schools. And so alphabetically with numbers starting first are all the schools in LAUSD. And then they have the estimated percent positivity, the number of students in that school year based on last year's school like the amount of students that were enrolled last school year, and then the community of the school. And then here is where the actual data is. So you can see it hasn't been populated yet for the 14th, but there's school-linked cases and community-based cases. So school-linked would mean that someone tested positive as a result of exposure at school, and community-based cases means that there was someone that became positive somehow throughout the community. Numbers that are in green means that that number has gone down from the week before, and numbers that are in red mean that they have gone up. So I was a little confused at first when reading this. So it's school linked, then community linked for the same day, and then school linked, community linked. And this goes back to the beginning of the school, around the 20th is when they started this. And so you have to read the columns when thinking about green versus red, or if cases are going up or down, you have to skip to the next column, like skip a column in between. And then at the top, these are the total school site active cases. So on the 13th, there were 1,500 active community-based cases. There were 0 school-linked cases. Then on the 10th, there was 1 school-linked case and 1,301 community-based linked cases. And then these unassigned cases mean that they didn't determine whether it was school-based or community-based. So feel free to ask any questions. I'm going to go on to the next tab, which in this first tab, you'll see that there's the community of the school. And so this is the communities put together. So instead of all the individual schools, these are statistics based on the communities as a whole. And so this is the school district, I believe, and then this is the community of the school. And then similarly, there's the dates, the student and staff case rate. So that's the number of students and staff that are positive over the total number of students and staff per 100,000. So this is 24.78 per 100,000 population in Achievement Network. And then they compare this to the LA County case rate at that time, so on the same day, and then the community case rate being the surrounding community. So here you can see, Canoga Park, Chatsworth. This is the student and staff case rate for all of the schools that are in Canoga Park and Chatsworth. LA County case rate is the same, 20.3. And then the community case rate of Canoga Park and Chatsworth is 20.25. And the same thing, if it's going up or down, it'll be green or red. And this is traced back to the weeks of the 25th. And that's for like every community of the schools. And then independent charters, I went to Granada High School, and independent charters are linked and have their own separate data. So this was Granada's, they only list current confirmed cases and previous, but you don't have a metric like over time. So then this data is used to populate this, which is also done by the parents supporting teachers. I'll put this link in the chat. And so this is, let me clear the filter. This has all the schools and creates these 2 different like charts, bar charts. One is of active cases. And so this is where you can see since the reopening of school, or since them starting this database, you can see over time the number of cases on each of these days. And so this is combining, like I said before, there's school-based cases and community-based cases. This is combining them. So there's 1,261 both community and in-school cases in all of LAUSD. And then down here, this is pretty hard to read because this is all the different communities. So there's like a lot of little bars down here, but that's comparing it to the LAUSD average case rate. So these are the case rates of each of the communities, which we saw on here, and then compared to the LAUSD average case rate. And so I had in Andesol here. Because I knew that they had some cases. So just to go through an example, so you can choose any of those schools. You could type it in, you can see the active cases at that school from starting August 19th through September 13th. Then you can also compare the case rate of that school's community. So this school's community is Kennedy, Nas, and Vaz. And compare that to the LAUSD average case rate. And through this dashboard, you can also look at the community. So since Andesol is part of the Kennedy and the Northridge Academy, I can look up Kennedy. And these are all the schools that are within that community. And so this is cumulative of these 20 schools that are within this community. And you can see the active cases, and then again, the case rate of that community compared to the LAUSD average case rate. And let's say you wanted to look for a specific school. That's where this comes in handy. You can go to the individual schools, you can find the school. So I was doing Andesol. And then you can see what community it's in if you want to look around what other schools are used. And this is helpful, especially like, let's say, you know, your kid goes to a school, but their babysitter goes to the nearby high school. You can see what the community spread is in all of those schools in that community. That was the example that the parents gave for why they wanted to include that data. So these in combination with each other are pretty helpful for seeing how the pandemic has played out in either this community or a specific school since the school year began, and also seeing how that either community or school compares to the LAUSD average to see if that school is faring better or worse or about like similar. And then here at the bottom, if you have just one school, it'll just have one school. But here, since we're doing the community and it has 20 schools, you can see what school and the cases, and then the percent positivity rate. And you can see if you hover over the number, you can see where they're getting that positivity rate from. So 1,681 over 100,000. So then, like I said, this one isn't working right now. But usually here, it'll have the different schools listed. And then when you click on the different schools, it'll tell you the status of that school, whether it's open, it'll be green. If it says open, but it's yellow, it means there's an active outbreak, or it'll say closed. It'll list the positive cases among staff and students, and the cases from school-based transmission. So this data does not include cases from community-based transmission, and it only includes the active cases currently. So unlike that bar chart, you can't see the cases over time. And then it'll give you the staff and student case rate, the community case rate, and the LA County case rate to compare these different rates, which are the same data that is given on this community of schools. So you have the staff and student and staff case rate, LA County case rate, and the community case rate. And so here, what I was explaining, it has open that's yellow means there's, an active outbreak and that those people are in quarantine, or it'll be closed. So I can drop this link in the chat for future. It was working all day until about like 5:30. So you can hopefully be able to load that soon. And then the last is just the LA County COVID-19 data dashboard. This is just the main page. It's the one that's probably the simplest to use. The other ones have a lot of different options, but this one shows you the cases, the new cases reported from the 11th through the 13th. The total cases reported thus far throughout the pandemic. Then it has testing. If you click on these little graphics, they'll expand. And this has the daily reported number of persons tested, but it's reported as a past 7-day average from 7 days ago. They do that because of, to account for a variation throughout the week in testing, especially like for the weekends. So they report it as a 7-day average. Then there's the testing positivity rate, which is the number of positive tests over the total number of tests represented as a percentage. The death rate, or the total number of deaths, which is also reported as a past 7-day average from 7 days ago. And then the death rate, and this is age adjusted, like Dr. Mani was talking about, which will account for differences in like age distributions across different populations. And then it's sorted out by race, ethnicity, and the poverty of the area. So that's like basically race and place. And then we can see daily number of hospitalizations. And this is a past 7-day average, again, reported as an average to account for, variation across throughout the week. And so just to like recap on absolute numbers and rates, the testing and the deaths and hospitalizations are all reported as absolute numbers. They're reported as averages. This positivity rate is a rate. You can use that to compare. It's represented as a percentage. And then this one is really helpful because it's both age adjusted and it's reported per 100,000. So you can compare across races, ethnicities, and different locations, considering the percent poverty. And that's the only other dashboard. You can also see other dashboards if you expand this. This is just like the basic one, but you can look at the COVID-19 dashboard. Gets much more complex. It has, if it loads, there's like a map right here. And this is like rates throughout LA County, and you can see based on area. And so I think now we can just have people kind of play around with the different dashboards and ask any questions that you may have. Stop sharing.
Should we maybe get, I wonder if people can just post in the chat, like approximately, like how many minutes would you want to, like you can just do like a number of like how many minutes you would want to look through things, and then we can maybe Celine is a big fan of this like lo-fi hip hop channel. I can play a little bit of music in the background and people can look through these and then come back with questions for Bita and Brianne. Do you want to post in the chat what number you're feeling? Not to keep the two of them too long either. Cool, I see a 5, I see a 2. Another 5. Cool, a few different 5s. Let's do 5 minutes. And Brianne, did you already put the regular LAUSD dashboard link in the chat?
Yeah, that's the I can
sorry,
read.
not the LAUSD, sorry. The Los Angeles County one. Sorry, that's what I meant.
Oh, let me put that one in the chat.
That's like the simplest one, right?
Yeah.
And the in the Google Doc for the PowerPoint, the links to the dashboards are at the
Yeah, they're the last slide before the extra slides.
Cool. So I'll post that link to the slide thing one more time, and I'll share audio. Oh, I can't. I think I can't. Okay, we can do it silently then. Oh, no, I can. I think I can. Here we go. Okay, great. About 2 more minutes, everyone. Okay, everyone, that was about 5 minutes. If people have questions, now is the best time, whether it's about the Barbara Ferrer presentation from earlier about the LAUSD specific stuff, or whether it was about the various dashboards that Brienne showed us, and the LA County one, which is the easiest one, or the LAUSD ones that are school specific. Anything that they presented on, Dr. Amani and Brienne, feel free to ask questions right now.
Or I would just love to hear from people if there's like, if we're on a like who cares about data stuff, or to get coalition or to get coalition feedback on just the ways that schools are going to like continue. Like, this is like another level of like an indicator by which schools are going to either succeed or fail. You know, like as you were going through that that dashboard, Brienne, that just really was so obvious. You know, that in the process, like the data right there is like marking all the schools. You know, and depends on whose hand, like who's, you know, it's through people and policies and institutions, right? And that kind of momentum that data then informs decisions. So anyways, there's a level of concern around that as well. So we would, Brienne and I would love to hear from you all about if that's something you're all thinking about, or just anything related to public health and surveillance right now.
Reminding people they can post in the chat or send a message to one of the hosts anonymously if they prefer, or a comment or a question. We have a question in the chat. Are LAUSD students required to use the Daily Pass app?
My understanding is that they are, right? And that the Daily Pass app is the symptom checker. Unless anybody else here has any other knowledge about that. My son is in LAUSD, and I know we have to do it every day. Some days they're like the scanner that they have, right, like on the phone or whatever, that they're checking the barcodes. It works, and some days it doesn't. At that point, I don't know. They're just looking at on a sheet of piece of paper, and then they're asking, "How do you feel? Do you feel good or do you feel bad?" And my son is always like, "Eh." Just take this checkpoint seriously, please. Do you know what I mean? Like, they're asking you a question over here. You need to not, you know, you need to realize you have to be serious. But my understanding is that it is.
Maybe while people are typing their questions, I have another one as well, which is, you remember that, so when you were talking in response to Hamid's question earlier about the reduction, and you were saying these are moments that each time it's happened, we've not taken advantage of them and acted smartly as a collective. What would that look like? If we were seeing a reduction, what would the caring and smart response collectively, either on a policy level or an individual level, be?
I mean, I think it has to do with orientations, right? Like they all this stuff is in place to make sure that having people out of the house is safe. But whatever is happening, like in terms of like the home, like whatever, if you, whether you have one, you don't, whether it's like, you know, you're under threat of losing it or not, like none of that stuff matters, right? Like, so none of this is about the health and well-being necessarily of the people, versus making sure that how we all come to be around each other in certain public spaces is sustainable for the healthcare system, and also sustainable for like certain neighborhoods that have like, you know, they have enough power and privilege to have to have the audacity that a certain level of health is acceptable to them, right? And so I think, you know, at moments where we're seeing like transmission rates are starting to come down, like this would be an even better time to like go to people's homes, like to do things that are about like outreach, about like checking in on people, making sure that they're getting, you know, like services, they're getting connected to care, and doing some of the prevention work across like a whole host of stuff. And it's not like that stuff should stop anyways, even when, you know, like we're seeing ourselves in a surge, but that when you're in a surge, like, you know, the risks change, and so what you think is like more like what you think is more safe, you know, isn't. And so my point here is that like when transmission is lower and we're able to like even imagine like opening up, we really need to then continue to push harder for the basics to be in place, so that if we are in a situation where it's not, we don't continue to see the type of disproportionate impact that they have, right? In all types of like disasters or outbreaks, like the gaps between people increase even more because the consequences of it are not even. And that's just it, right? So like in moments like this, like the, you know, the importance of like whatever they're defining as even equity right now, right, would be important. I mean, dude, there's still a lot of reports out there that people are not getting access to like healthcare, and there's still a lot. You know, we were supposed to report out that we had been building with Youth Justice Coalition. You know, out of the space that they organize, Chuco's Justice Center, they have the Free LA High School, which is part of like the Youth Build Charter, and they were not able to get access to consistent testing enough for them to open up in a way that would made them feel safe. And so we were able to work and get them regular testing. And last Friday, they started with the testing of students and staff, and they had like, I think over 30 people tested. And there's also the opportunity for vaccination. And some people wanted to be able to get vaccinated, and they did, right? So, you know, but this is, you know, for example, just like the first phase, like we need to add more services, right? Kind of to that, if we're thinking about, you know, putting things in places that still continue to have a hard time to get access to stuff. And a lot of the work that we did, you know, in the beginning of the pandemic, people were obviously talking about how the requirements to be able to work in a healthy way outside the house and what's needed are not being provided by the employer, but still the demand is there. And also like the laws are being written in such a way as to like really make the employee like very vulnerable, right, across all types of formal and informal sectors. So not having testing both connected to your employer and connected has its like own different benefits. But you know, this is kind of, you know, so even when as periods of like where like the transmission is going down, I think continuing to do the work to increase people's opportunities for access to stuff stays important. Oh, there's a question in the chat.
Yeah, I can read it out loud. Thank you to the person who wrote it. So this question says, just out of curiosity, was the Parents Supporting Teachers Coalition started during the pandemic? Are they the only ones collecting and sharing school-specific data at this level of specificity? And can we expect this data to continue to be updated throughout the school year? I'm in awe at their ability to do all of this.
From my understanding, yes to all of your questions, and I think they somebody published either a statement and it might have been on a Facebook post that gave some sort of history to the parents. But the data dashboard. The coalition. I don't know when the coalition was started, but Brianna's saying that it was started in 2018. But the pandemic dashboard obviously started during the pandemic. Brianne, do you have more information about the coalition itself?
I just know I read on their About page that they started in 2018. They started as like a Facebook group. There was a strike going on among teachers, and they started like this Facebook group to share data surrounding the strike. And then they kind of like formed this group to like support the teachers that were striking. As far as collecting and sharing school specific data, that's as far as I know. It's them and LAUSD doing this data to that like level of specificity. And they're using they're not collecting the data themselves. They're using the LAUSD data to populate the Excel sheet and those, and then that Excel sheet is used to create those graphs. And hopefully the data is continued to be updated throughout the year. They're using the LAUSD data, so we know that the data will still be collected, so long as the volunteers that are doing it right now continue to, populate the data based on the LAUSD data.
And I think so it's great to know that this is not their first data like monitoring project of like LAUSD. That's, I wonder if we have, do you have a link to the strike data that they, like data set that they collected before? That'd be interesting to see that. But I think I saw someplace that they were committed to doing this for a minute. The only way I could see that it would stop is if somehow there's a change to the data source, and then we need to spend some time thinking about how to like extract and connect it. If, for example, it started to be, displayed in a different way, or organized in a different way, which is a really important point because these systems are constantly being updated in different ways, and they will put out announcements on when they're down, and when they are doing upgrades, and in all of them there's like, if you kind of dig deep enough, you can see like a table is there with like kind of historic data. So even if like the visualization is in one way, and then you like look below and it says like download data here, like, or data table, and you click on it, you'll, for example, see like a table that has data in all these other different ways, and maybe you have your own question, which is probably better or different, right, than the one that that they're showing. Like I think Akil, maybe some of the questions you had around like not enough specificity, like you wanted to see like those neighborhoods like break down more by case rates, right, to organize like risk. Like I think they would have a table there that you could pull that from.
Thank you. Yeah. Any other questions or comments or curiosities or explanations needed from the community for either Beta or Brienne? And also, if you're getting tired of typing it, feel free to just unmute yourself and ask it. People should have the ability to unmute at this point. How are you two feeling on time? I have one question, but I can also ask you two later. And also we have community updates on our campaigns that we were going to do. But if you have time, I would love to ask it, but also wanted to respect your time.
I have about 10 more minutes, but so
Okay.
you.
So I personally am really interested in just the clearest way to tell if a neighborhood that I live in or I'm going to, or that youth live in, or that the people I'm talking to are in, is experiencing either low, moderate, substantial, or high transmission. And it seems like case rate is like the more stable metric, because when we talked in a previous time, you two had, I'm just summarizing for everybody else here, that the positivity rate, which is just what percentage of the tests are turning out positive, it can seem artificially low if they're suddenly testing and retesting a huge number of people, which is what has happened with the school districts opening. But case rates are more stable because it's per population, it's per 100,000 people. So that's not going to fluctuate as much. So I wanted to ask about, just really quickly, this specific, let me even just pull it up, this dashboard of LAUSD, not LAUSD, LA County. And there's this, in this COVID dashboard, in the very first page, there's, I don't know how to get back to it. Here it is. There's this map. And this map allows you to look at different areas in LA with a 14-day rolling average. And that way you can just look at your area and see kind of like what color it is and if it's high or low trend according to this. However, the thing I was confused about is that the CDC guideline is for 7 days. So I'm wondering if I should just double that number of 100 to 200 and to see if this value is over 200, does that mean that that area has high transmission? For example, city of Vernon has a case rate that's really huge right now, which means that it's probably an extremely bad outbreak right now, the city of Vernon, because this case rate is almost 2,000, 10 times what that doubled number is. Or should we keep it as 100, in which case literally all of LA is experiencing some kind of high transmission? I'm just curious, if you were to suggest for people what's the best way for them to know if the area they live in is under what level of transmission, not just LA County as a whole?
What happens, Akil, if you hit on the left the table 7-day community case? Does that not give it? That gives it by geography too, right?
Yes, so you
So
can
this is
look up
that.
your area here. Oh,
Yeah.
I see. And then this is the number you can plug into that threshold table that the
Yeah.
CDC has. And by the way, that table's in their presentation. So if you bookmark their presentation, it's one of these slides. So that way you can always look up your neighborhood in the dashboard. Look at that number. So for example, I'm in East Hollywood. So I could kind of zoom over to that at some point here, look at that, and then look at this number, the 7-day case rate, and then look at that threshold table, which is right here, and then see where that falls. And that's how I would know.
Based on those metrics, yeah. So I mean, based on those thresholds, I mean, I'm continuously, we're still trying to do some good research on like
Oh,
the
got it.
shifting changes of these thresholds. So yeah, everything you said is the best thing that we can do right now. But we still need to do more investigation into these values. And this is part of what we were saying before around, us needing to build more participatory kind of, like to think about like what our own thresholds would be. But those are the numbers that they're using. Those are the metrics and indicators they're using on a larger county level to make decisions. So that should have some usefulness, right, to us as organizers.
Got it. Yeah, thank you so much for answering that.
To answer your question though about doubling, for that 14-day rolling average, you're not going to double it because it's an average. So it's not that you're doubling the 7-day. That number is being represented as an average, whereas some numbers are reported over the past 7 days. That's a cumulative 7 days, as opposed to this 14-day rolling average versus like over the past 14 days.
Because they're going to ultimately divide by 14 and get the number of new cases per day.
Right. So it's a daily average as opposed to like cumulative over 14 days.
But it looks like some of the numbers are also 14-day cumulatives. So this was something that we were reflecting on both in presentations and also in the way that the data is displayed. It can be confusing. And really, like, Brianne's point's like a really important one here. Pay attention to what's cumulative and also what's a average that's daily. Because the metrics or the thresholds are different if it's a daily average versus a cumulative one over a period. And like you're saying, Akil, the CDC's guidelines are based on 7-day cumulative, rates.
Yeah, so I can share, I don't know if it'll be more confusing if I share this other slide from this other presentation we had. But this is the positivity rate, the high transmission. This is total new cases over the past 7 days. So this is a cumulative number. Where the California guidelines, this is daily new cases. So more than 10 daily new cases as opposed to more than 100 total new cases over the past 7 days. So that's why it's important looking at whether Dr. Mani and I thought we found two wildly different guidelines, where this says, it's widespread if it's more than 10, and this says it's widespread if it's more than 100. But that's because this is saying the total new cases over the past 7 days, where this one is the daily new cases. So that's like a per day metric.
Got it. And what's coming down the pike for this group? Is there a plan to create some sort of like step-by-step easy tool that we could help distribute in this webinar as well? Not today, obviously, but like when it's created, just to like give the community that little preview or a little teaser.
We've been doing a lot of work around taking a look at like the surveillance systems that are the public health surveillance systems that are being built, like thinking through the types of data that are being collected. What does that information sharing landscape look like? And then also, your question, Akhil, about what do we do right now as things have started to when we're seeing, decreases in rates, right? Like, what does that mean? And we've been really trying to think about what would a series of expectations be, right, that we could put out there. But what we're seeing since the reopening is a lot more requests for what we're doing right now, which is like trying to think about ways where people can access the information that's in real time people are making decisions about. And we're seeing a lot of information circulate that 2 weeks knowledge, evidence from the data from 2 weeks ago is data from 2 weeks ago. Like, so much stuff is changing like constantly. So we see ourselves right now doing a lot around thinking about tools to break down data, show where data is, and to give sample questions that the data can answer those questions to see if people are interested in answering those questions at all. So we hope to be able to get to that place where we can have a tool, as this seems to be a growing request that we're getting.
Cool. Well, thank you both so much. Is there a way that people can either get in touch or send emails or send questions through us if they have it in the future?
Absolutely, and I'll put my Gmail here too, if folks want to reach out.
Awesome. And if they wanted to get involved in the public health group, would they also reach out through these same emails to find out about how and where, when to help out?
Yes, absolutely. And I think Hamid can connect everyone directly too.
All right, thank you both so much. And yeah, Hamid also put the coalition's email. In the last 20 minutes of the webinar, we're going to do a couple community updates on where the campaign is at, and the fight to end the war on youth, and also what's been going on in the school district when it comes to a historic motion in solidarity with Palestine. So Celine, if you can take it away. And everybody, thank you to Dr. Bida Amani and to Brianne McAndrew from the Public Health Group. Thank you both so much. I'm going to spotlight Celine now.
Hey everyone, let's see. Thank you so much, Bida and Brianne, for that presentation. That was really great and really helpful, actually, for me too. And I think that I can just give a quick update about the UTLA stuff and what's been moving. So earlier this summer, or in spring in May, and apologies, like my house is pretty loud right now, so you're gonna hear a lot of stuff going on in the background. But earlier in May, after the major mobilizations, a handful of teachers put together, drafted some motions in solidarity with Palestine, and saying that resolutions that included things like, support, standing in solidarity with Palestine, with Palestinians. And, we also talked about like ending military funding to Israel, the $3.8 billion in military funding to Israel, and supporting BDS. And following that, there was, a lot of support from the community. Like, we had a letter a community letter that was drafted by the Palestinian Youth Movement, and we also had a letter from the Jewish Voice for Peace to show our community support for the teachers who put forward these resolutions. And following that, of course, we saw a lot of Zionist backlash. And part of that Zionist backlash came in the form of the school district, LAUSD, passing a unanimous motion to quote unquote, I can't remember exactly what it was called, but it was a motion about, supposedly standing against anti-Semitism, but the entirety of that motion was mainly about how it was kind of in response to what was being put forth by UTLA members around Palestine. And it was really a response to any of the support around Palestine. So the point of these motions that have been coming up, or the backlash, has been to completely silence any criticism of Israel, especially in this time where the world is becoming more aware, I think, of the brutality of Zionist colonization. And I also think that there was so much backlash against the teachers and these resolutions that first the school district passed, and then more recently, the LA City Council actually passed a resolution affirming that LAUSD resolution, is a way to just try to criminalize any type of political activity regarding Palestine, any speech around Palestine, any criticisms of Israel would be considered criticisms of anti-Semitism. So, Akil, I'm not sure if you want to, if we want to pull up the resolutions actually to look at them, but even if they don't mention the IHRA definition of anti-Semitism, which we've gone over in past webinars, regardless, they're still kind of affirming the same thing, that any criticism of Israel would be considered anti-Semitic. So what does that mean for any type of, what does that mean for the motions that UTLA members put forward? What does that mean for Palestinian, Arab, or Muslim students or any student who wants to talk about Palestine in the classroom? What does it mean for any ethnic studies that would include Palestine? So this puts all of that at risk. And what we're seeing now in our fight to end the war on youth, and where we're going with our campaign, is that, we had prepared, we know that these same organizations, these same Zionist institutions that are pushing, that are, enacting so much backlash to any of the Palestine solidarity that's been coming up in the schools, are the same ones that have accepted countering violent extremism funding, that are pushing countering violent extremism frameworks for surveillance and for, criminalizing political activity in our schools. So we're integrating all of this into our campaign strategy, and we just wanted to share the update too, also, especially most recently, about what happened at the LA City Council. So we also have a toolkit, a community toolkit, where we prepared a bunch of talking points and information about how, what exactly is going on in terms of these resolutions, and kind of unpacking the language that they're using and what they're trying to say. So ultimately, it's about trying to silence any kind of pro-Palestine voice or any type of criticism of Israel. So I don't know, Akil, if you want to show the resolutions or how we want to talk about the most recent city council stuff.
Sure, maybe I can even just show a little bit of the video of Blumenfield.
Oh, yeah.
And so maybe after that, we can also do a quick update around the research and the records requests too. But yeah, let me quickly show this video. This is a city council meeting from late August. And Blumenfield, when putting forward the city council measure, makes it very obvious that he's specifically targeting the LA teachers for their organizing.
Thank you. Colleagues, today I rise to ask your support for on this resolution. And I want to thank my colleague, Ms. Rahman, for seconding it. And I especially want to thank the hundreds of parents and teachers who wrote in to support it, and Dylan Hosier of the Israeli American Civic Action Network for his activism on this. This resolution simply supports recent policies adopted by LAUSD to prevent and combat anti-Semitism at Los Angeles' public schools. While the message is straightforward and fairly non-controversial, it's particularly important now because anti-Semitic incidents are on the rise in California, in Los Angeles, and across the nation. In addition, there is a well-organized and systemic effort among some educational stakeholders to demonize Israel and disenfranchise Israeli immigrants in Los Angeles. And if we don't stop this effort in LA, it will spread to other places and around the country. Israeli, Jewish, and Arab alike, and American Jewish students, staff, and families within LAUSD, schools, and offices maintain cultural, linguistic, historical, and family ties to Israel. Efforts to marginalize that connection violate their educational and workplace rights, and by extension, legitimize bigotry to all religious, ethnic, and other marginalized minorities, especially immigrants. And like any immigrant community in Los Angeles, I believe that Israelis deserve the right to connect to their culture and celebrate their heritage free from bias and bigotry. This resolution in support of LAUSD's efforts to combat anti-Semitism helps preserve this right. I wish in this day and age that this resolution wasn't necessary, but it is. It is necessary because some at LAUSD were promoting a BDS or boycott, divestment, sanction motion, which was not only inappropriate and way outside of the scope of LAUSD's jurisdiction, but it was anti-Semitic in my estimation, because it treated Israel differently than every other nation and would put Jewish students and teachers who rightfully support Israel's right to exist as a Jewish state in a terrible position and subject them to a hostile environment. Even if the vast majority of students and teachers had real problems, like I have real problems with Netanyahu's policies and practices, that BDS motion was not only biased and one-sided and based on spurious assumptions, it dehumanized and demonized Jews and Israelis. Our kids are dealing with enough turmoil to try to get back to normal. Sitting in a classroom after managing horrible learning experiences outside of the classroom for a year, why would we want to create an even more anxious environment for any of our students? Every child should be able to learn in peace. Behavior of those promoting BDS has no place in our schools and is just as antagonistic and contrary to what we teach our children about being inclusive. The motion before us doesn't address the BDS issue. It merely is against hate and anti-Semitism. But context is important, which is why I raised that, and I ask for your aye vote on this resolution.
Thank you so much, Mr. Blumenfield. Seeing no other speakers on the queue, Madam Clerk, can you open the roll on this item? Close the roll, tabulate the vote.
11 eyes.
So it passed, and I think it's a very important clip because he actually clarifies that this resolution that is on its face supposed to be about ensuring Jewish safety, it's really for him, he's conflating Jewishness and Zionism, and it's really about preserving Zionism within LAUSD and fighting against anti-Zionist organizing. What's not contained within this speech is that the resolution directs the school district to consult on curricula, instructional resources, reading lists, and other things with the Anti-Defamation League and the Simon Wiesenthal Center, which are the two organizations that Celine was talking about that have either, in the case of Simon Wiesenthal Center, accepted CVE or in its case, PVE and TVTP grants. And then ADL, which even though it hasn't accepted a CVE grant, was actually a partner in at least the Houston, Boston, and Colorado programs, and was even consulted within LA's programs. And it was so much a partner that the ADL presented at the CVE conference in favor of CVE when it was originally debuted. So all of this to say that these organizations, as Celine was saying, are sort of non-state facilitators of the state's agenda, which is the state is itself trying to criminalize youth through these programs. So in our campaign, we have a two-pronged approach. We have we're looking at and trying to research the connections to these Zionist organizations, but we also have a laser focus on the state itself. And because of that, that brings me to the last thing we wanted to update the community on, which is our records request that we've submitted to the city of Los Angeles, whether we've submitted it to departments such as the LAPD, the Department of Mental Health, the county or the city attorney. We've submitted it to some of the city councilors, the California Department of Education, California Office of Emergency Services. And we've already started getting records back. And we've specifically asked not only about communications with these organizations, but about specifically communications with two academics, David Eisenman and Stephen Wine, that have been really, that have been very central because they first received a Department of Homeland Security grant in around 2015 to evaluate and then provide suggestions on CVE in LA. And since that time, they've been very central in guiding and facilitating the process of creating and changing and reforming and transforming these surveillance programs in LA. So we are finding out more about what's been happening in LA through their emails, as well as through emails with these two Zionist organizations, the ADL and the Simon Wiesenthal Center. So if you would like to get involved and help us comb through these emails, figure out what we know, what we want to know, how we can dig deeper, and then ultimately how we can popularize this knowledge and then combat the state armed with this knowledge, combat to ultimately abolish these surveillance programs and have schools and communities without surveillance. So our working meeting is tomorrow at 6 p.m. and we have a regular working meeting every third Wednesday of the month at 6 p.m. on Zoom. So email Celine at her email, which is in the chat, c.kusini777@gmail. If you're able to come tomorrow and want the Zoom link, you can also email me. I'm going to put my email as well. And you can also email the coalition. Here's the coalition's email again. Stop LA, whoops. That's supposed to be at gmail.com. Stop LAPD spying. And so if you want to get involved and help us look through these records, we have records already that we're starting to look through. So we would love to have you. That's tomorrow at 6 p.m. Any questions on these two community updates? Also, not wanting to put too much pressure, but Brianne, we would love to have you back to help do research whenever you're free and ready. And Sydney, I'm expecting you tomorrow.
I will for sure see you there, Raquel.
Oh, and the other thing is this month we might also do, and hopefully gonna do, a second meeting a week after tomorrow as well. So in case you can't make tomorrow but wanna come next week, let us know in the email to us. Cool, well, 5 minutes early. If there's any questions, feel free to let us know. Otherwise, we can wrap it up. Any announcements, Hamid?
No, just next Tuesday is our general meeting, so join us. We will be looking at the current political landscape, where things are going, you know, looking at 4118, the municipal code that the city of LA rehashed, which criminalizes unhoused people, criminalizes poverty, criminalizes race. So then we'll also be talking a little bit more, digging into a statement that we had released on 9/11 on the 20th anniversary and reflections from the coalition on that. So look forward to it.
All right, with that, we can let everybody finally go have dinner.
Thanks, everybody.
Thanks, everyone. Have a good night.
Yeah, have a good night.